lifestyle medicine is a big movement that's happening within medicine as a whole. A huge focus on preventing, treating, and even reversing the chronic diseases we're seeing nowadays by taking our unhealthy behaviors and replacing them with positive ones. So the American College of Lifestyle Medicine has been around for about 15 years, and now it's a board certification that physicians can get. This is the third year that's been the case. It fits so nicely in the current medical system because to be a board-certified lifestyle medicine physician, you need to hold a board exam already in a specialty. So typically it's internal medicine and family practice doctors, but cardiologists, a lot of rheumatologists, and endocrinologists as well. It's all evidence-based medicine, and it really focuses on treating the cause of disease. So lifestyle medicine focuses on 6 different areas of health: healthful eating, physical activity, moving more, managing stress, making sure we get enough sleep, no smoking, and moderate to no alcohol. And the biggest piece is actually the forming and maintaining relationships. So it's nothing new, these different areas, but where lifestyle medicine comes in is it's really focused on how do we make these changes, right? We've all heard eat well and exercise, but how do we actually get it done? What it is not, a few different areas of medicine, they're growing. So functional medicine, it is not functional medicine. I tell patients all the time, instead of trading this handful of pills, functional medicine is, instead of taking this handful of pills, now you're taking a handful of supplements. It is not that. Integrative medicine, that's the merging of the Western and Eastern type of medicine. So it's not that. And it's not non-Western. We're not telling people or advising people to not abide by the current recommendations, but actually the current recommendations have lifestyle changes as the background of all treatments for all of the chronic diseases that we're seeing. This is the best slide of the whole deck. So this is really talking, compare contrast of our the current medicine that we have today and lifestyle medicine. So current medicine, or conventional medicine, as we call it, it's very good for episodic, emergency type care. So, for instance, if someone were to come in with a pneumonia, the doctor comes to the physician or the practitioner, and, the patient comes to the physician or the practitioner, and the patient comes asking for help. The doctor diagnoses and then gives treatment, provides the treatment for that condition, and then the patient goes on their way and gets better. So the patient is a very passive recipient in it, and the onus is on the physician to accurately diagnose and treat and to provide that treatment. It's typically one-on-one, so one doctor, one patient. We talk a lot about side effects and making sure we balance the side effects of the different medications with the possible benefits. So lifestyle medicine, the way it's really focused on treating more of the chronic disease. So a lot of these chronic diseases that we're seeing, it takes many years to get to the place of having chronic disease. It's not something that comes up easily, and it doesn't go away easily. There's a huge partnership between the patient and the physician, and that partnership is really what makes the big difference. The patient and the doctor decide, the diagnosis is there and made by the physician, but the treatment is based on both patient and physician. A lot of times it's the physician helping the patient identify their own goals and really lead the way, but the patient is the one that's doing the active treatment. A lot of times it's done in group settings because people perform much better if they have a support system in that group setting. And the treatment is always long-term. So when we're talking about treating a specific area, if we're talking about treating diabetes, when we treat that, we actually treat the patient's risk factors and reduce their risk for heart disease, for cancers, for dementia at the same time that we're addressing the diabetes. So it's a much bigger as far as the impact. And why lifestyle medicine? So this, I didn't add too much information in this because anyone who's been watching the news, it's pretty well publicized, really, the crisis that we're in with chronic disease and healthcare expenditures. It's over 80% of the healthcare expenditures that are spent on chronic disease. It's actually 85 to 86%, again, of all of our healthcare spending is on chronic disease. And most chronic disease does not need to continue to exist. We just haven't had the correct treatment for this type of disease yet. But really why there's been such a huge movement to this area is the results that are produced. So like we had touched on before, when we treat a specific disease with lifestyle medicine, we don't just treat that one, we actually lower the risk of all of the diseases. The one treatment focuses will actually impact risks for everything. So lowers our risk for heart disease, diabetes, high blood pressure, high cholesterol, cancers, specifically colon cancer and breast cancer, and prostate cancer as well, dementia, osteoporosis. And there are a number of intensive lifestyle change programs which have had a lot of studies on them to see the return on investment. Typically, the return on investment is about $2 saved for every $1 spent. So to patients, I would tell them that you can see here that it's working because people are actually getting better and getting better within a period of 6 months, 12 months. In fact, some of the times, or a lot of the times, within 2 weeks, we have to drastically reduce the amount of medication that we're giving people because they're getting so much better. To the health system, of course, and to our crisis, this is huge to be able to save $2 for every $1 spent on health care. And another example of that is the Ornish Lifestyle Medicine Program, that we can actually see reversal of heart disease. So Dr. Ornish is one of the 2 doctors that have ever shown this true reversal of heart disease without surgeries and without medications. And Medicare is reimbursing for this. So this is something that's covered by individuals' health care dollars. So this, so for patients, but I guess especially for physicians, the reason why I have this up here is because there's so many tools now. Lifestyle medicine, as we had initially talked about, nutrition being huge, relationships being huge, in the treatment of these chronic diseases. These are not things that have typically been in medical school training. And so it's additional training, and as such, the doctors that are interested in this, we're doing a lot of extra hours of learning about nutrition and exercise and sleep and stress reduction and how that can actually affect our genetics, truly. There's a big, epigenetics is a big area where there's a lot of research where we can actually turn on or turn off genes or upregulate or downregulate genes. So actually show that there's more cancer growth or less depending on what we do with our bodies. Blue Shield of California, and the reason why it's on here is because it knows that there's such a benefit with lifestyle medicine. The Blue Shield of California, they're actually paying nurses, health coaches, and medical assistants. They're helping support training in lifestyle medicine with scholarships to get more people interested in truly keeping people healthy. So Walk with a Doc, so we started it here in Ventura County, so just a few months ago, and then the networks. So as you all are aware, that we talked with our clinically integrated network and then the IPA in the area as well. but to hope to do a pilot program and really get the word out, partnering with the community education, getting the word out to the newspapers, and getting people interested in knowing that there's another way for treatment.